All right, good afternoon, everyone, and thank you so much for joining us for today's webinar on working adults with disabilities for home and community-based services, or HCBS. We're going to be discussing the changes and updates. My name is Kira Acuna. I will be presenting alongside Nancy Brenes. Really quickly, though, we're going to dive into some webinar logistics. So we are recording. Please avoid sharing any protected health information. Additionally, we have Spanish language interpretation is available in the toolbar at the bottom of your screen. There's a visual on your screen that shows where that interpretation pod should be. All attendees are going to be muted during the presentation. You will have the opportunity to raise your hand to ask questions, but we ask that you use the question and answer or the Q&A function for any questions that you would like us to respond to. And materials will be distributed after the meeting. With that, I'm going to hand it over to Hans. So Hans, please take it away.
Sí, hola, mi nombre es Hans y yo estaré brindando los servicios de interpretación en español en un momento, y este servicio estará activado. Para escuchar la interpretación en vivo en español del evento del día de hoy, seleccione el módulo Interpretaciones en la barra de herramienta de Zoom y luego seleccione Español y tendrá la opción de seleccionar Silenciar audio original, y si desea escuchar solo español, en este módulo de interpretación se activará momentáneamente.
Okay, the language interpretation pod is on. Thank you.
All right, thank you. And for our Spanish speakers, there are Spanish slides that Ryan will be dropping in the chat. Again, that is just a copy of these slides in Spanish for those who are Spanish speaking. So with that, really quickly, who is HCPF? So HCPF is the Colorado Department of Healthcare Policy and Financing. We are designated as Colorado's single state Medicaid agency and are responsible for the supervision and oversight of Colorado's public health insurance companies. And there should be a link to our website that will be dropped in the chat if you are interested. Our mission is improving healthcare equity, access, and outcomes for the people we serve, while saving Coloradans money on healthcare and driving value for Colorado. What we do, so HCPF administers Health First Colorado, which is Colorado's Medicaid program, Child Health Plan Plus or CHIP Plus, and other healthcare programs for Coloradans who qualify. Once again, this is an informational meeting. You will have the chance to ask questions and provide comments. The meeting is again being recorded and will be emailed out to everyone who registered for today's webinar. As far as asking your questions or providing your comments, please, we're asking that you type them into the Q&A box. I'm not sure if the chat is available to everyone, but we ask that if you do want a question answered out loud, please drop that into the Q&A versus the chat. Additionally, you can also raise your hand and we will unmute you when it is your turn to speak. So those are a couple of options. Finally, we're also offering up that you can email Nancy directly, and her email address will be dropped in the chat as well. And with that, I'm going to hand it over to Nancy. So Nancy, take it away.
Awesome. Thank you so much, Kira. Alrighty then, so let's have a brief overview of what we're going to be discussing today. First, we're going to have what is what, our Working Adults with Disabilities program. What is what with HCBS, which is what these changes particularly pertain to, and what those changes are that are being made, as well as what is the impact of those changes. Next slide, please. Okay, so what is Working Adults with Disabilities, also known as WAD? Working Adults with Disabilities lets adults with a disability who qualify to buy into Health First Colorado, which is Colorado's Medicaid program. If you work and earn too much to qualify for Health First Colorado, you may qualify. If you qualify, you may pay a monthly premium. Your monthly premium is based on your gross monthly earned and unearned income after any applicable disregards. Next slide, please. So what are our eligibility guidelines? You must be 16 years old or older. You must be employed. You must have a qualifying disability, either through Social Security or the state disability determination vendor, even if you are 65 or older. The Social Security Administration, or SSA, has listings that describe what disabilities qualify. And your income after disregards must be below 450% of the federal poverty level, or FPL. For example, you can earn up to $11,020 a month and still qualify. You may have additional income that is also disregarded. Next slide, please. Applicants should always complete the Health First Colorado application to find out if their income qualifies. As I mentioned in the previous slide, we do have like a rough number there, but for your income, but there could be other disregards that could apply that can help you qualify. So we always encourage everyone to apply. You are not required to apply for SSA disability. If you don't have a current disability determination from the SSA, fill out the Health First Colorado disability application. And finally, for this program, resources and assets are not considered. So for example, checking accounts, savings accounts, property, vehicles, and none of those resources or assets will be considered. Next slide, please. Okay, so what is WAD with home and community-based services, also known as HCBS? Next slide. So in addition to Health First Colorado benefits, members may also qualify for long-term services and supports. These additional services are accessed through the following HCBS waivers: brain injury or BI waiver, community mental health supports or CMHS waiver, complementary and integrative health or CIH waiver, developmental disabilities, DD waiver, elderly, blind, and disabled, EBD waiver, supported living services, SLS waiver. Next slide. So what is changing? Next slide. Again, for members that are in this WAD category with HCBS services, with those waiver services, we'll be discontinuing auto enrollment into WAD with HCBS at enrollment and renewal. Members will need to opt into WAD with HCBS. Members will now be reviewed for long-term care eligibility first. Next slide, please. So why is this changing? Many members have not experienced premiums. As such, we do not want to place them in a premium paying program first. We want to inform of the buy-in program participation being voluntary and something that can be opted in or out of as requested by our members. Next slide, please. So as I mentioned in the previous slide, the premiums for the buy-in programs are returning. So the working adults with disabilities and the buy-in program for children with disabilities will resume in May of 2025. On February 8th of 2025, we sent out a heads-up letter to all our buy-in program members, letting them know that the premium letters will be sent out April 23rd of 2025 with a due date of May 15th of 2025. The premium letters will contain a statement that details your premium amounts, the premium payment methods, and other details associated to your premiums. We will have a sample of those at the end of the presentation. Next slide, please. So what will this look like? So members will now be reviewed for the long-term care program. All eligibility requirements for that program must be met. If a member is not eligible, they will be reviewed for WAD and other programs. If a member is found eligible for long-term care, the member wants to be evaluated for WAD with HCBS, the member will need to opt in to the WAD program. Next slide. So how will this look for new members versus ongoing members? For any new applicants that require the HCBS services, they will be reviewed for the long-term care HCBS program first. If found eligible, they'll be placed in that category. If members prefer to be in the WAD with HCBS program instead, they can opt in to be reviewed for that buy-in program eligibility. For ongoing members that are on WAD with HCBS right now, they will be reviewed for long-term care HCBS upon renewal. This will happen only on the first renewal after this change is implemented, which is going to be in June of 2025. So if they are found eligible for long-term care with HCBS, they'll be enrolled in that program. However, members can decide to opt back into WAD if preferred. That's one of the most important takeaways that I definitely want to get during these presentations, and that is, again, that it impacts members which are receiving those waiver services through HCBS specifically, and that although at renewal or at first renewal or application, they will be reviewed for long-term care first, if they don't meet the eligibility criteria for that, they will still be reviewed for WAD with HCBS. Again, WAD HCBS is completely voluntary, and you can request to opt in or out of it at any time by contacting your local eligibility site, contacting local case management agency, or online through the PCAM. Next slide, please. So what is the impact of these changes? The impact will be on new application processing and eligibility review, as well as renewals. The expected impact for both applications and renewals will occur starting in June 2025. All eligibility requirements for the long-term care program must be met. This is a very important consideration of the impact of the changes, in the sense that the long-term care program has different financial eligibility criteria than the WAD program, which means that you may be required to provide further verifications. So the process might be a little bit different than it would be for WAD. But again, if you are an ongoing member for WAD with HCBS, this will only occur at your first renewal after June 2025. After that, each renewal will continue to be for what program you are at that time. Next slide. So as I mentioned, this is a sample of the heads up letter that went in February 8th, and it tells our members, how we had suspended the premiums in 2020 due to the public health emergency, and how the premiums are going to be returning. Next slide. It also provides information on how can they make payments, who can they contact for further information. Next slide. This here is a sample of the actual premium letter that they will be receiving in April. As you can see, it will contain the name of the member, the program that they're under, as well as the actual premium that will be paid. Something important to note is that the Working Adults with Disability program is a premium paying program. However, some members in this program may have a zero premium. So it's important to check your statements so you can see what category you fall under in order to make a determination if you want to continue on the program or not. If you're not sure if the premium paying program of Working Adults with Disabilities is the best choice, you can also reach out to your case management agency eligibility site for more information. Next slide. That is all I have for now. I'm sure there are plenty of questions. So Kira, do you want to take it away?
Yes. Yeah. So thank you, Nancy. I do see that we have both hands up and questions in the Q&A. So I think we're going to stop at the Q&A first, and then we'll get to those verbal questions. I also just wanted to state, because I forgot this at the beginning, that along with the recording of today's presentation, you all will also receive a copy of the slides in both Spanish and English, as well as the recording in both Spanish and English. And so I just wanted to reiterate that you will all receive a follow-up email with a copy of these slides. So with that, let's jump into the Q&A. So Ellen is asking, so do we need to fill out the Health First Colorado disability application if you are already qualified under SSI?
Let me look at the thing. Sorry, I just need to read that myself. Do you need to fill the Health First Colorado? If you are qualified under SSI, then likely you should be receiving the SSI Medicaid coverage. So it would really depend on what program you're already under. And also if you're talking about moving to the buy-in program? I think I need a little more clarification on that question.
All right, next question. Are there other benefits to completing a Health First Colorado disability application? Or is this the only purpose for that form?
I'm saying nothing, sorry. That disability application is going to be relevant for sure for the buy-in program, but I believe long-term care and other programs that have a disability determination requirement will also need this form. The children's buy-in with disability will also need this form.
Okay, thank you. Will members need to know to opt in, or will Medicaid tell them about the program, especially if over the income and/or asset requirement for long-term care?
So when it comes to the renewal, the actual renewal, that first one that I mentioned, you members will be reviewed for long-term care HCBS first. There will be a cover letter on that the renewal explaining that they're going to be reviewed for long-term care and HCBS first, as well as how they can opt in to be reviewed only for what if that's the path that they want to choose. So we are informing members about the choice at renewal.
Next question. Does the 300% rule for HCBS not apply if a person opts into the Working Adults with Disabilities buy-in program?
So the financial criteria for the waiver services under the Working Adults with Disabilities will follow the Working Adults with Disabilities financial criteria. So it would go by WADA rules, so to speak.
Okay, thank you. One of the reasons HCPF changed this to auto enrollment in the first place was because people were bouncing back and forth between the county and CMAP. Sorry, I don't know what CMAP is, otherwise I would have said that out loud. Do we expect that to happen again?
So we don't expect that to happen. One of the biggest plans that we have for the projected change, as I mentioned earlier, was that we have a concern of having members being in a paying program first and a premium paying program first. So that's why we're going to be reviewing them for long-term care. However, this whole change is going to apply only once during that renewal process, that first renewal process, and then it should not happen again.
Okay, thank you. What if new members' income only meets criteria for the buy-in program and not HCBS waivers? You may have just covered this.
Yes, that's what I was mentioning, that the HCBS waiver financial criteria is usually applicable when you're receiving long-term care services. When you're on WAD services with HCBS, then it's only the WAD financial criteria that you have to meet.
Thank you. If someone on the HCBS waiver is long-term care eligible, why would they choose to opt into the buy-in program? Is it so they can go over the $2,000 resource limit?
Correct. So the whole purpose of the Working Adults with Disabilities is to allow our working members to accumulate resources and assets, which is not something that they can currently do under the long-term care program. So that would be the main differentiation.
Thank you. If the buy-in program income limit is $11,020 per month and HCBS income limit is $2,901 per month, then what is the monthly income allowed if eligible for both, and are assets still disregarded?
Okay, so this is a variant of the previous questions, but I'll still answer it. The income guidelines, when you have HCBS with WAD, the only ones that need to be met are the ones from WAD. So those 11,020 that I mentioned would be the actual limit, and assets and resources will continue to be disregarded even if on HCBS, if you have WAD.
Okay, thank you. Please clarify for me that if someone is not found eligible for, I assume that's supposed to be long-term care, they will automatically be reviewed for the buy-in program. Because it is voluntary, will the case managers explain it, or is the individual, or does the individual have to know about it on their own?
So it will depend on the scenario. As I mentioned, at renewal, and we're talking about renewal of someone that's already in WAD, we're going to have that cover letter explaining that they're going to be reviewed for long-term care. Because those members have already been on WAD, then it really shouldn't be necessary to have any like further information on that case. Of course, we do have all the documentation encouraging members to contact case management and the eligibility sites. And when it comes to actual first time applications, they will be reviewed for long-term care, and it's because of the HCBS component. Again, this will apply only to the HCBS members, so they'll be reviewed for long-term care with HCBS, and if they don't qualify for that, then WAD with HCBS would be the next choice because of the HCBS component. Otherwise, then they would be reviewed for any other program. I hope that helps.
Thank you. We anticipate this will increase the number of people who get an income trust sent to them, ones who have not opted into buy-in. If so, what support materials and resources are available to help people to understand why are they being asked to complete an income trust? Will there be information explaining the choice to opt into buy-in instead of submitting an income trust?
So yes, as I was talking earlier about the impacts of this change, and one of them was the application process or the renewal process and the eligibility criteria for long-term care being different from WAD, that would encompass this. So yes, trust. Now, before I get into that, I do want to state for the record that our system will review them for the information that we have, and we might have enough on file where no further verifications are needed. If further verifications are needed, such as an income trust or anything else, then a checklist will be going out to the member, or the income trust form will be going out to the member so they can go ahead and fill that out to be considered for the long-term care program. If the member does not return that paperwork, then they will not qualify for long-term care, and they will be continue to be reviewed for other programs, including the WADA with HCBS. As per resources, we will be having a supporting memo and a web-based training for our eligibility sites, and we're partnering with our case management agencies as well for them to know the impacts, as mentioned earlier, on the application and renewal process.
Okay, thank you so much. What are some reasons someone would not qualify for long-term care if you are a current working adults with disabilities member?
So some of the reasons could be they are over income, that they have an excess of assets and or resources, and also that they may not have returned any verification paperwork that was requested, among others, but those are usually the primary ones.
Okay, thank you. What is the range of premiums? I understand some may experience a $0 premium. What is the maximum or the cap?
So the maximum would be $200. And I can go ahead and look up real quick. I believe it's 4 brackets, but I want to double check. Bear with me.
Okay, and you'll be dropping that link in the chat.
Yes.
Okay.
It is the link for our Working Adults with Disabilities main website, and it's either $0, $25, $90, $130, and $200.
Okay. Thank
And
you.
should I put that in the chat, you said?
Yes, if you want to drop that link in the chat, that will have income requirements and those premiums.
Okay.
That was a great question. Next question is, what form of payment will be accepted for premiums?
Bear with me, 'cause that
Yep.
one is in the exact same spot that I was just looking. um, okay, so, and this will be in the premium statement. It will have the different ways that you can go ahead and make payments. I know that we have an option for direct bank account enrollment and card. Let me see if I have the exact ones. You can pay in person, by phone, and by mail. here. Yes, so I don't have all of them, but I do know that at the very least, we have the option for direct withdrawal from banking accounts as well as cards. I believe you can also pay in person with checks.
Okay, thank you. To answer that person's questions, no, if you get SSI, you do not need to also fill out a disability application. So that's more of just a comment. I am a buy-in CIH member and I'm very grateful for it. Each year after my recertification, I am always asked for all of my asset reports, including checking accounts, etc. And then I am disqualified for Medicaid. It causes great stress during the interim, sometimes as many as 6 weeks before we are able to explain the working adults with disabilities aspect, and I am recertified. Is there a way to prevent this from happening each year when I'm recertified?
Let's see here. Checking accounts. So unfortunately, I do need a little bit more information because I understand that the renewal packet does include asking for resources and assets such as checking accounts, bank accounts, and such. Um, Filling that out is not a requirement for the working adults with disabilities. So I'm not quite sure if in this particular case it's being left blank and you're receiving like additional verification for you to provide it, or if you're filling it out at renewal and then that's generating over income or any other issues.
Okay, thank you. Does this program pay for the Medicare premiums for Medicare eligibility? In other words, if a member has a $75 premium, will that include everything and technically make them a QMB plus eligible?
So the buy-in, the Working Adults with Disabilities does pay for Medicare Part B, and it does allow dual eligibility with QMB, who picks up the copays and premiums and others for most Medicare. So yes.
Thank you. Would spousal income make the spouse ineligible?
No. So when it comes to working and the caveat that I am talking about the working adults with disabilities specifically, um, those are considered a household of one. So only the member's income is going to count. When it comes to the renewal for long-term care, then the spouse income will count towards the financial eligibility criteria. So yes for long-term care, no for one.
Okay, thank you. What if I do qualify for the buy-in program, but have recently lost my job and oddly don't qualify for unemployment? Do I no longer qualify for the buy-in program?
Unfortunately, the requirement for the working adults with disabilities is that you do need to be working. If that coverage was lost, I would recommend still contacting your local eligibility site or case management agency to see if there are any other programs that you can qualify.
Thank you. If I do qualify for long-term care, do I still need working adults with disability? And what is the difference between the two?
So for this project change, if you do qualify for long-term care with HCBS, which is the members that are going to be impacted by this change, you would not need working adults with disabilities with HCBS. Both of these provide the HCBS services. So the only reason why you would need the working adults with disabilities is if you were to be over income assets or resources for the long-term care program. But again, it does have premiums for many members, not all. So if you qualify for long-term care, since it doesn't have a premium and it doesn't have a work requirement, then likely it would be more beneficial to stay with long-term care. So it's really going to depend on whether you want that working requirement and where you land between the financial eligibility requirements for long-term care.
Thank you. Similarly, do you have to qualify for long-term care to be eligible to apply for working adults with disabilities?
You don't have to qualify for long-term care. The what I do want to mention is that sometimes those HCBS or waiver services get confused with long-term care. So the long-term care program itself is separate from WAD and you don't need to qualify for it. It's that HCBS portion that you do need to qualify for it, regardless of if you're in long-term care or in WAD. It's the additional supportive services. Those have a different level of care criteria.
Thank you. Is there a place in Peak or on the renewal packet where you can check a box to opt in to the buy-in program?
So it will not be in the packet. The packet will only have the cover letter explaining to you where you can go to opt in. So Peak, correct, it will have an option to opt in into programs. And we also have the resources of contacting eligibility sites or the case management agency.
Thank you. So a person with WAD cannot have home care in any sort.
So people, our members with WAD can have a home care. Those HCBS services, which are the additional in-home services, can be provided either under long-term care or under WAD. The only difference being, again, the qualifier of WAD that requires you to have, to work, and that has different income criteria.
Thank you. We have a 16-year-old DD waiver client who was enrolled into Working Adults with Disabilities and HCBS in 2023 or so. They were not on it before then. What would they lose if they opt out of the buy-in program next month or May?
Okay, so I'm going to answer with the information that I have. These members will be reviewed for long-term care at that first renewal. If they opt out, then they'll likely still be reviewed for long-term care. So whether they opt out now or they wait at renewal, they'll still be reviewed for those long-term care with HCBS services. If they meet the eligibility requirements, then they'll be enrolled in that program. And really nothing is lost in the sense that both of these will have the HCBS that they require. So they wouldn't really lose anything if they qualify for long-term care. If anything, what they might lose would be a premium. If they are paying one with WAD and they move to long-term care because they're eligible, then if they were paying a premium, they will no longer pay. And
Thank you. Does the disability application have to be completed by a doctor? Where can we find information about the qualifying disability?
So the disability application does not need to be completed by a doctor, and it can be completed by our members. We do have some guidance on the actual disability application. About the qualifying disability, the Social Security Administration has listings with qualifying disabilities. I can go ahead and look that up and drop it in the chat as well.
Okay, thank you. If they are enrolled into long-term care, they are then subject to a state recovery, right?
Correct. Long-term care does have different financial eligibilities. It does look into assets and resources, which is part of what the estate recovery entails. The working adults with disabilities does not have that requirement.
Thank you. My question clarification is that my daughter gets waiver services and Medicaid currently via WAD. And she is on SSI, or she is SSI eligible. So why does she have to complete a Health First Colorado disability application?
So she actually doesn't. If she's already currently in WAD, it means that at some point that disability application was already completed. So that won't be necessary. The only thing that she would need to complete would be at her first renewal, well, really every renewal, the renewal packet. As I mentioned, at her first renewal after this change, she will be reviewed for long-term care. If that's not something that you want, then you would need to opt in back into working adults with disabilities. But again, that's only at that first renewal. Every renewal after that, she will continue to be reviewed for working adults with disabilities.
Thank you. A comment, CMAP is the Colorado Medical Assistance Program, and they manage the buy-in program. Thank you, Amy, for that. I really appreciate that. If a member on the HCBS DD waiver receives SSDI and wants to work above SGA and would therefore no longer qualify for SSDI, but could continue to qualify through WAD, how soon before changing work hours should they submit a Medicaid disability application?
Look at that. So I do want to state for the record that it's not only through the Social Security Administration that we determine disability. We have a state vendor that also does that, and they actually will review that that SGA as well, the sustained gainful amount. So they will review that as well. The Medicaid disability application, I would go ahead and submit that as soon as possible, since the actual process can take about 45 days, sometimes longer. WAD does have a 90-day retroactive coverage, but I would encourage for it to be done as soon as you know that you might be changing your hours.
Thank you. A follow-up to a different question. Also, my daughter got laid off from her job in November 2024. Will she get switched from WAD to regular Medicaid automatically?
So the change in employment is something that does need to be reported as a change due to income change and employment change. Once the change is reported, then the system will evaluate her for any other program that she may qualify.
Thank you. What resources does the state offer for those unable to complete these applications on their own due to language barriers or other factors? Oftentimes, Human Services said they are not allowed to help with applications.
Especially for our buy-in members, we actually have a dedicated buy-in number that can be reached for our what was referenced earlier as CMAP, and they have resources that can allow you to obtain this. So let me go ahead to obtain assistance. So let me go ahead and get that number, and I will go ahead and put it in the chat.
Thank you. So if a person qualifies for a WAD, then this could be a pathway to qualify for a waiver. Is this an accurate determination because the financial requirements for a waiver changes to be the WAD requirements?
That's correct. Yes. Someone that may not have qualified under the long-term care due to the financial criteria of the waiver might be able to obtain those waiver services through WAD, even though their income is higher, because the WAD income limits are the ones that would apply.
Thank you so much. Do they have to apply for ARG again at renewal?
They would not have to apply again at renewal. I don't know what the user-friendly term is, so I apologize, but I know that we have a date in our system that will to which the disability determination goes to. So when you're originally determined by ARG, they give us like a future date of to when the disability is considered end dated or when it needs to be reviewed. That's the date to which it would need to be reviewed, not renewal.
Thank you. I have type 1 diabetes. I've been receiving benefits through Health First Colorado for the past few years. Are you aware of these programs being affected by current government cuts?
So we don't have any information of any particular program being cut. I know there were concerns during our last meeting about waiver services going away, which also we do not have any guidance to state that. Like all our programs are still active and ongoing.
Thank you. I believe we've answered this, but if they're enrolled into long-term care, then they're subject to the estate recovery, right? And that is correct.
Yes.
Okay. Also, will there be a new disability application coming out?
We do not have any changes coming to the current application at the moment.
Thank you. When does this start? I believe when does the the premium start or the opt-in start?
Oh, I'll answer both just in case. So the changes for the WAD members being looked at for HCBS, I'm sorry, for long-term care with HCBS for both, it will start in June of 2025. The premiums start being due again in May of 2025.
Thank you. When will the 2025 premium chart be released?
So the 2025 premium chart will be effective April 1st. That's when the new guidelines go into effect. We might release it the same week of April 1st.
Thank you. Can long-term care case managers update income and resources for clients, or must they use the Peak portal or general Medicaid member line to update these items?
Unfortunately, that's more of an operational question, so I'm not quite sure like what accesses they have to report these changes.
Okay, thank you. Where can I find a list of the income disregards?
So we have a memo. We're actually in the process of uploading the 2025 memo, but the current valid one, which is 2024, again until April 1st, does have the some of the disregards listed. Most of the like specific disregards are listed in our code of regulations known as volume 8. But the more common ones to calculate a premium are found in that 2024 income memo. Let me see if I can get that real quick and post it in the chat as well.
Okay. In the meantime, in the case of business income, what is considered for WAD, gross or net?
In the case of business income, I don't know that I understand what you mean by business income.
Well, I guess just in the short, are we considering gross or net income?
Usually it's after, it would be the net, it would be after all the applicable disregard.
Okay, so the net income.
It was the business income part that had me down.
Yes, thank you. So can a person still be on both long-term care and WAD at the same time if they're over income for long-term care?
So I just want to make sure that we're using the same terminology in this case. Long-term care is one program, and working adults with disabilities is another program, and they both can have long-term care services, which are these HCBS that we keep referencing. So you can have long-term care with HCBS, and you can have a WAD with HCBS, but you cannot have long-term care and WAD together because they're separate programs.
Thank you. To follow up on an earlier question on why someone would want the WAD buy-in program when on SSI or SSDI, Medicare costs are still high. Being dual eligible, Medicare opens up lower costs. Please confirm that this is still available under the new process.
Correct. Dual eligibility with programs such as like our qualified Medicare beneficiaries and other programs known as SlimB will still be dual eligible to help with Medicare cost sharing as well.
Thank you. Can someone remain on the DD waiver and do buy-in program? For example, if they have residential services through a PCA or a host home, can they remain in their host home or PCA apartment while also making $11,020 per month under buy-in?
Correct. As we talked about earlier, when you are on those HCBS or waiver services, the financial criteria that is needed is the one of buy-in and not HCBS. So those 11,020 would be the income criteria.
Thank you. How many people are projected to be eligible and directed to case management agencies' intake department? CMAs will need to be prepared on how to handle influx of triage and enrollment.
Unfortunately, I would need a little bit more information as to be eligible for which of the programs.
Thank you. Is there anything I need to tell my home care agency?
Um, I don't think so. It would also really depend on what program you're currently on. If you're already on long-term care HCBS, then really no change is going to be needed. If you are on WAD with HCBS, then I would just be mindful of that first renewal that occurs after June, since we will be reviewing you for long-term care. And if you don't want that, then you would need to opt in. But again, it would really depend on which program you're currently in.
Thank you. What are the work requirements, minimum pay or minimum number of hours per week?
So there actually is no minimum pay or number of hours per week or per month. We don't have any restrictions or minimums.
Thank you so much. Does this program assist with transportation like IntelliRide or TransDev?
So unfortunately, those are very specific, and again, it would be operational, so I don't have any information on those. If those are services that you're currently getting, say, through long-term care HCBS, then they should remain under buy-in HCBS as well, since they are the same tier of services.
Thank you. Also, can you qualify as for WAD when only working self-employed and receive all income on a 1099? Do buy-in need to be W-2 employees?
It doesn't have to be W-2 employed. Self-employment is also a valid form of working for the eligibility criteria to the program.
Fantastic, thank you. How long do you have to get a job if you leave or lose a job while on buy-in?
Yeah. We don't really have a set amount of time. Members are usually required to report any changes in income or work status within 10, I'm not sure if it's calendar or business days, but I know it's within 10 days of a change of circumstances. So at that point, when the change is reported, then the eligibility criteria will no longer be met, and our system will review for eligibility for other programs.
Thank you. Did you say that people can opt into buy-in with their CMA? I'm not sure if I misheard you, and the CMA would not be the appropriate place for folks to opt into buy-in.
So it would actually be CMAP. It would be our case management agency. I'm sorry, the acronym. Someone just gave us the acronym. Those are the direct number that we're actually giving. And to avoid confusion, we're actually not using terminology in that sense, but we're actually providing the phone number, which I provided in the chat earlier, and we're referencing as like our direct buy-in line and our buy-in vendor.
Thank you so much. Just to confirm one more time, is qualification for HCBS required to qualify for WAD, or can a person just qualify for WAD?
A person can just qualify for WAD. The HCBS are waiver services for those additional like spinal cord injury and brain injury. So some members may not have a need for those services, but they can still qualify for WAD and buy into the program.
Thank you. Does the WAD maximum earnings limit generally increase slightly each year to account for inflation and annual cost of living salary increases?
Yes, the amount does go up every year. Earlier, I was referencing how April 1st of 2025, we'll have a new income guidelines that do go up based on the established federal poverty level. Those are the numbers that we use, a percentage of that number.
Thank you. Does receiving long-term disability benefits as income from one employer still count as employment so that an individual is able to stay on WAD?
I guess it would really depend on if you still have a working relationship with the employer. Like, even if you're not making any income through the employer, are you still considered their employee? You if that is the case, then you are still considered employed. If you are no longer associated with the agency, if you're no longer employed but receiving that benefit, then that would not qualify.
Thank you. Does WAD pay for benefits planning services?
I am not quite sure what benefit planning services is in this context.
Okay. Please note that CMAP cannot help people fill out the disability application, only the Medicaid application. Thank you for that comment.
Thank you, Bernadette.
Is an ARG/Arbor review required if the person is already determined disabled under SSI?
No, in that case, that it wouldn't be necessary.
Thank you. Benefits in Action or Colorado Access may be able to help with some of those applications. I know they can help with Medicaid, SNAP, etc. Thank you for that comment.
I do want to chime in
Um,
real quick. I do
yes.
apologize. I know that we have agencies that help with disability applications filling out. I'm just not sure if we have some that are specific to the disability application.
Okay. Thank you. Disability diary date is approval of the disability app is usually 7 years.
Yeah, I didn't want I didn't want to get into our like CVMS terminology with the diary date because I don't know that everybody is familiar with the term, but that is definitely the name of the date. Specifically diary date, yes, specifically to when we were talking about when they would need to have a redetermination of the disability.
Okay, thank you. Can you clarify estate recovery?
So that actually came from one of the questions. It wasn't really a part of the presentation. It is a part of what happens with the long-term care services when you have when you are over assets and resources. Then there is it's what it sounds like, a state recovery. If we have Melinda on the line, I don't know if she wants to provide like a very basic overview.
Melinda, do you want to chime in?
Can you hear me?
Yes.
Awesome, great, thanks. So estate recovery is for when members over the age of 55 and have received a medical assistance benefit, and at the end of their medical assistance coverage, either due to their case terminates or the member passes, potentially our Medicaid estate recovery team would assess in the member's estate for any payback for benefits that Medicaid had paid for during the time the member had received Medicaid. We do have a website, and that kind of goes into this a little more in detail with contact information and a fantastic flyer that you can even keep and share with folks that you're working with that I will put into the chat.
Great. Thank you, Melinda. Just want to be cognizant of time. We have only 5 more minutes. So if we do not get to your question, here's Nancy's contact information on the screen. Ryan, I would also ask that you drop her email in the chat once again. Again, we're going to try and get to as many of these questions. But if we don't get your question answered, please shoot Nancy an email. So what is the easiest way for people with long-term care and HCBS who are automatically enrolled to opt out of WAD?
I don't know about the easiest way because the easiest way for me and for you might be different, but overall, doing it through Peak could be considered easiest in the sense that you don't have to contact anyone. You can just log in and do it yourself. But not everyone is great with electronics and technology, so contacting our buy-in vendor could also be a good option.
Thank you. If a person was on SSDI then went over full retirement age, SSA will convert to SSDI to retirement income. Does the person have to complete the Colorado disability application?
I'm not quite sure what happens with the disability terminology in that sense. Basically, the way that the state of Colorado operates is that we receive interfaces from SSA that tells us when someone is considered disabled. So if we're still receiving that interface stating so, then we would not need it. However, if in that conversion process that is no longer being communicated, then we would need the disability application for our state our state vendor to make the determination.
Thank you. I'm an authorized representative for a participant. Her CDOS annual year goes January to December 2025. If there are cuts to services, can her 2025 CDOS total amount be cut?
As mentioned earlier, we really have not received reporting of any particular services or program cuts at this time.
Thank you. I normally renew in February, so is that when I will get the next long-term care application? I just want to clarify when I will need to opt into WAD.
Correct. That's when you will be receiving it. If you have a change of circumstances before that, like if your income change, if your employment changes, then of course the system will like re-review you for all the programs. But if nothing changes, then yes, it would be in February of 2026 in this case for you.
Thank you. Just a clarification or a comment, care manager, care coordinator for those working on adults with disabilities. Thank you for that. Do you get dental and vision coverage with these programs?
These get the same services that any of our Health First Colorado Medicaid services receive.
Thank you. One thing to keep in mind for those on SSI would be that SSI still has a resource limit regardless of WAD status. Is that correct?
Yes, like the actual SSI has its own threshold. We only decide what the state threshold is going to be with the WAD program.
Yes. Again, we don't have any information regarding budget cuts at the state or federal level at this time. However, once we do have information, I promise you will all receive that as soon as we know as well. Will services continue while being reviewed for long-term care?
Yes, so the services will continue. There should not be a gap in coverage as long as we receive the packet at renewal.
Okay. What if I'm on SSDI and don't work and don't qualify for HCBS? Can I still get Medicaid?
Unfortunately, we would need to know more details such as like financials and depending on the program, any applicable disregards. So I can't really answer that specifically. What I would recommend is to always contact your local eligibility site and submit an application.
Can someone on medical leave for an entire month but still employed, or in the same vein, permanently seasonally employed, but not have hours every month, maintain access to buy-in?
Yes, as long as you are considered like the example that was given earlier where they were receiving a disability amount. So for example, if you're like out on sick leave or workers' comp or anything like that, as long as you're still associated and employed to the company, then you would continue to meet the criteria for WAD.
Okay. 2 points of clarification, and then we'll have one more question. So Colorado Access or AMES can't help when just a disability application is needed. Thank you for that. And benefits planning services helps an individual understand the interaction between federal, state, and local benefits and earned income. These individuals typically are certified in their area of expertise. Thank you for that.
Can you
And
pause real quick? Because the
yes.
question was if it covered those services. Since that's very specific as to benefits, I don't have an answer. I will say that if long-term care HCBS covers it, then what HCBS should cover is this is supposed to be the same coverage.
Okay, thank you. And unfortunately, folks, this is going to be our last question, but for buy-in, does it have to be taxable income? In other words, if someone walks their neighbor's dog every month and gets a receipt book, would that be enough to show that they're working?
Oh, that's a good question. I know that at some point we had the self-employment ledger where you can go ahead and have that. And I know that we also have different forms of income.
So Nancy, I'm receiving a comment from Claudia that she is saying yes,
Yes. Okay.
that would be sufficient.
Yeah, like I
So
said, I know we have like a for that type of income, we have a like a self-employment ledger where you can report the various sources of working.
Yep. Thank you. And then Claudia saying they can have the employer write a letter. Thank you, Claudia, for that information. Once again, folks, thank you so much for all of your questions. I'm sorry we were unable to get to everyone's questions. But please shoot Nancy an email, nancy.brenes@state.co.us. You will all receive a recording of today's webinar along with the slides as well. And we just want to thank you so much for your time. And I hope you have a wonderful rest of your day.